Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course,
Brad,
Bob.
today we got top 3 advanced ways to increase flexion of your knee, especially after surgery, especially after like knee replacement or maybe a quadricep tear
Right.
or something where you're trying to get the bend back in your knee.
Right.
All right, let's go, Brad.
Yeah, and I've just been working with some people. Usually it's total knee replacements, but in the last few months I had 2 people quadriceps tore off the patella of the
Wow.
kneecap. Surgery back on, and they start out bending their knee only to 30 to 40 degrees.
Sure.
And then we're using these techniques to help them get along for passive range of motion or pushing it so you can stretch those tissues. One is, and this is for at home, we don't do this in the clinic, but if you're at home and you have carpet, the idea is we want to, in a chair, slide your knee back and forth like this. Now your knee's probably going to get to a certain point, and at that point, it needs to have some extra force on it to stretch the tissues, okay? If you have a smooth floor, you simply put a towel down on the floor, and then you can work it. Now, I'm going to show you on carpet a nice little trick.
Roll your pant leg up, Brad, so
Yep.
you know which knee you're working
Good
with.
idea. So I'm going to pull this up like here. So this knee is real stiff. It had surgery or it had a quadriceps tear.
It takes a cake pan.
Yep, and that makes it slippery. That's the only reason. You don't have to use a cake pan. Anything you can put down to make it slippery on your carpet. Same thing with a towel on the hardwood floor. And the reason I got this belt on here is because I didn't know where else to put it. No, I'm just kidding. I'm just kidding. You put that there, and you're going to need something to give some extra force. And if you're doing this by yourself,
So he's sitting sideways on a chair.
yep. And this works good with a steel chair that has steel frame, and rounded is good. This one's square, it'll still work fine. And I'm actually going to go like this, and they say it's as far as my knee will go. I can push with this foot a little bit to stretch it, and this isn't real fun. It's a little painful, but that's part of the doctor and your therapist will instruct you on this. And you pull here to get that extra stretch, and then go back. Now, I usually just work back and forth with my patients as opposed to get them into this part that's really uncomfortable, stretching and holding it there because it's painful. So if you could just relax. And another thing about this I find is if the person is stretching themselves versus someone else pushing on the leg or pulling on this, they're more relaxed, they have better results.
Yeah, they like to be in control.
Yep. So you're going to do this for about 3 to 5 minutes. And by that time, you won't want to do it anymore. You're going to need to give your knee a break, maybe put some ice on it. Stretch number 2. I like this next one a little better than this one. Let's get some of these items out of the way.
Which way do you want the wheelchair facing, Brad?
All right, you take that chair. You're going to need a wheelchair for this. Doesn't matter if it's on carpet or on hard floor, but it will wheel easier. It's better on hard floor, but you can do it either way. Here's that same knee. You're going to sit in a wheelchair, one that you can self-propel with your hands, okay? Now you're going to take the toe of the foot or the knee that you're going to bend, and you need to stop. You can put it up to a wall, but we don't have a wall here, so we're going to take this chair, put it right like that. Bob's going to sit on there. And you put your toe there, and you can butt it up against the carpet or the floor if it doesn't slip. But if it slips, you need to have something to get your toe up against. Grab here.
An immovable force.
You're right. There you go, Bob. And you're going to stretch like this. And as you can push with a lot of control and a lot of torque, a lot of good force. Oh, and you're going to feel it, and you're going to come back.
Yeah, that's a great advanced exercise.
Yeah, and I'll have people go 2 or 3 stretches, not real hard, and then on the 4th or 5th one, I say, give it a lot and hold it for
Give it
about,
the gas, baby.
Yeah, and they're gonna, oh, and then relax. You can rub that muscle a little bit between stretching, go back at it, but usually you do this for about 5 minutes, and you've had enough, okay? Now the last one, this is probably for the younger crowd, although I've done it with people in their 60s and 70s, is use the
There's
exercise
a ball up here, Brad.
Yeah, it's a red ball.
Alright.
All right, now,
Again, a little more advanced. Like you said, some people may not be able to do this one.
and actually just yesterday I had a person that he didn't want to get on it at first, but he was 71 years old actually.
Probably want to have somebody with you when you're doing this
Yeah.
one to make sure you're not going to
Right.
roll right off.
So you hold the ball there, after you work with this and you feel comfortable, you can do this by yourself. Let's say this is my sore knee, the one I want to stretch. You really should have something, you have to have something to hold on to. In the clinic, I use parallel bars, but I've had people buy their own ball and do this at home because they like it so much with total knee replacements. This knee doesn't want to bend, so I'm holding here for stability. It might take you a few minutes to feel comfortable on the ball, or a few different times, bouts. But once you get comfortable with it, and you simply roll forward, the knee flexes, stretches, and then you come back and give it a break. Stretch, give it a break.
You know what those balls run, Brad? How much?
They don't run ball, they roll. No, they're about $10 to $20 and up to $30.
So especially if you don't have a wheelchair, this might be a cheaper alternative than using the wheelchair.
Right,
And
yeah.
you can do other things with it.
Yeah, wheelchair, if you have one to rent, or you know someone, sometimes the Legion or the VFW where I live will just give them out to people in the community. They're
Sure.
small communities. And the other nice thing about the ball is you can stretch, and then you can actually bounce up and down, which gives a
Sure.
different angle.
Interesting.
And you do that for about the same amount of time, 5 minutes or so, and you probably have enough of it, and it's time to. And when you get off of all these stretches, no matter what you're doing, this is what's going to happen. You're going to get up, and it's going to hurt, and it's going to hurt, and you're going to walk like this. And you might need a cane or a walker.
Because it won't want to straighten out.
Yeah,
'cause
well,
it's been bent for so
exactly.
long.
And that's very normal. You walk around about 50 to 100 feet, and it'll get back to normal. And that's all part of the stretching game. You can ice it afterwards for 15 to 20 minutes. And I'm thinking that people can continue to get good ideas like this for home exercises from us, Bob. And if they,
Slap that subscribe
oh
button.
yeah, slap it, but don't wreck anything. Just
No.
be in your mind, slap it.
All right, be cool.